what we've been using all this time. Superior, anterior, inferior. So IOR means pertaining to. Then we have the other one that is not commonly used, but we are familiar with, which is dors or dorso or dorsal. Remember, means back, means the posterior part. AL, we know already that it means pertaining to. So let's say that you have a medical term, just guessing, just throwing something in there for me to understand whether you're following this lecture or not, or whether you are understanding it. If they give you a medical term that says, okay, what does this medical term means? When they tell you that, you have to translate it to English. So they give you the word anterior. So remember, you have to start from the suffix pertaining to the front. If you have dorsal, what it means dorsal? So you look for the answer that starts with the suffix pertaining to the back. So that's how you are going to manage this. Remember, this can be just simple questions on the exam. Whenever they ask you, when you start reading a medical term, translating a medical term, defining a medical term, what is the right way to do it? Then you look for the answer that reads, we start from the suffix first. The suffix needs to be the first one that we use when we are defining medical terms. Or in other words, when we are translating medical terms. That's how it works. If you don't use it that way, then you're going to be wrong. Oh, from pertaining to. Seriously, that doesn't sound good. From pertaining to. No, pertaining to the pertaining to the superior part, pertaining to the inferior, and so on and so forth. So you see, it's not difficult. It's just that we're getting to know these medical terms and how to use them, how to interpret them. Because if you don't do that, then it's going to be a little troublesome. So knowing certain definitions is going to help you to remember how to read, how to interpret, how to build a medical term. Some of the medical terms can be built with different parts. Some other medical terms, you cannot divide them. You cannot break its parts. We're going to talk about those because we have medical terms that you can break down and it is part, just like we're doing here. So others, no, you have to say, you have to write the whole thing, but you have to give the definition of what it means. Any questions? Lateral directionals. Now we're going to talk about the sides. Very important. We need to know superior, we need to know anterior, we need to know proximal and distal. But we are going to focus on the anterior part. Remember, the anterior part is all these, and the dorsal part of the back. So I'm going to mention that. So let's start from the anterior part. So anterior or ventral. These are the two medical terms that we are using. Remember, ventral, anterior. Anterior means front, ventral means front. the front of something, in this case, the front of the human body. Same goes for the back, posterior or dorsal. So that's how we need to remember this. If you have a question that is, okay, the doctor is examining the dorsal part of the body. What is the doctor examining? Then you look for the back. Back should be the answer. The doctor is examining the anterior part of the body or any organ. So what is the doctor examining? And then you're gonna look for front. Or vice versa. You can have a question that the doctor is examining the front of the patient's body. So what is the doctor examining? Then you're gonna look for anterior or ventral. Likewise, you're gonna do with the posterior. The doctor is like, oh, the patient is complaining about back pain. So what is the patient complaining? Posterior pain, dorsal pain. See, that's how these questions are built. Because the patient, when they come to our office, they don't say, oh, I have this pain in my anterior part of my chest. They don't say any of those. They said, oh, the front, the back. Oh, I have pain in my back. I have back pain. So we have to translate that to medical terms when we document them. So very complex, because the only time what we document exactly what the patient says is when we are writing down the chief complaint. My back hurts. Well, that's exactly what I'm going to write down when my patient tells me that. My belly hurts. I don't question my patient if I'm a medical assistant and the patient is registering in the front desk and comes to see the medical doctor. And when you ask, how can I assist you? After you greet the patient and introduce yourself, then they're going to ask you, you're going to ask them, oh, what is the reason of your visit today? So then they're going to say, oh, I have a belly pain. My belly hurts. Well, you have to write down exactly that. You don't ask more questions. Oh, do you mean your stomach hurts? Your abdominal part hurts? Can you explain to me? They don't know. They just say the words that they understand. And it's not our job to question anything else for clarification. I have pain right here. I have something right here, just exactly the way they say it. That's the chief complaint. You're going to write down exactly what the patient says. That's it. Then it is the doctor's job to investigate, to ask more questions about what's going on. They're going to get the details, not us. Remember, these are questions for national certification. When you're writing the chief complaint, what are you going to write down? The patient's own words. You do not change anything. Oh, I think that the patient, when says that the belly hurts, I'm going to put there abdominal pain. Did the patient say I have abdominal pain? No. The patient can sue you for that. Because it probably means something else. There are many organs in the part of the belly, but we're not accusing the patient. We are accusing you for changing the patient words, because that's not what the patient says. So remember, this is not just medical terminology that I teach. I teach you how to use these terms, when to use it, when not to use it. Remember, when we talk to our patients, we don't use medical terms. Yeah, it's nice to try to show off that you learn all these big words. But what is the purpose? You're going to get the patient more confused, talking to them language that they don't understand. This is like me trying to talk English with a patient that is Spanish speaking. They're not going to understand anything that I'm saying, even though if it is good. They not understand it. Well, you do not use medical terms because this is Greek and Latin. They don't speak Latin, they don't speak Greek. And even though if they speak Greek, because they are from Greece, medical terms are not the way to go. They're not gonna understand it because these are medical terms. If the person didn't go to medical school or to take any of these classes, they're not gonna know. So be simple. Use layman terms. Never use slangs. No, unacceptable. So once again, it's learning how to use correctly these medical terms. When should I use these medical terms? With who? Remember, these are the main questions for exams. Your exam is not going to be something that is very complicated. Oh my goodness, they're going to give you all these fancy words that you know. Simple things, how you're going to address your patients, how you are going to communicate effectively with your patients. Because if you're not using the language that they understand, you're not communicating effectively. You are communicating, but the patient is not understanding anything. So there is no communication, no effective communication. It's just one side. Because remember, communication means interaction of words or something else in between two people. At least you don't communicate with yourself. Oh, Alberto, let's go to the kitchen. Alberto, let's go to the school. Oh no, I don't want to go. No, you gotta go. That sounds like a little crazy, right? Me communicating with myself. So communication requires at least two parties, two people. And one has to be listening, active listening, not pretending that they listen. And the other one has to be communicating using a communication language that the patient can understand. Then we have effective communication. Okay, so let's move on from these lateral directional anatomic terms. These are easy because this is anterior, posterior, dorsal. The one that is a little difficult right here is ventral. But once again, just in case you encounter this somehow or on your exam, you're gonna know. Remember that when you don't know the word, you never heard about it, you never encounter it, it's gonna be difficult for you to point at that correct answer when you see it. So basically that's what it is. Where are we gonna use these directional? These directions, lateral directional, we use it in X-rays. See, that's what I'm giving you an example right here. It says right here, chest X-rays lateral view. Whether you have to work for the radiology department or not, whether you end up working, I know some medical assistants that end up working in a imaging center. And they train them how to do this, how to do that, how to position the patient, how to operate the machine. Not many, but hey, they got a job. So it says right here, the lateral, it can be lateral left, lateral right. So the doctor is going to tell you, the technician, whether it's a medical assistant, whether it's a X-ray technician, okay, I need a lateral view of the patient's chest or the patient's leg, the left leg, the left side of the hip, the right side, the posterior part, the anterior part. So once again, I need to know where to position the patient. Draw blood from the left side of the arm or the right side. Apply the electrodes doing an electrocardiogram on the left side, on the anterior part, on the chest area. So directions are very important. When you're doing an X-ray, you gotta put your hands above your head towards the superior part. You have to be standing, see? The anatomical position. So we need to understand directions because we use directions somehow. Right here it says lateral, remember? On the bottom part, left, lateral. Lateral means size, and RAL pertaining to. It can be the right, not the left. It can be the anterior, the posterior. Because we want to see certain organs, certain structures, depending of the position of the patient, depending of what the doctor is want to analyze, depends of the symptoms, the complaints that the patient have. So all depends of a variety of situations. We just need to understand that that's how it works. But we need to use the correct terms so we can understand the orders that the doctor is giving us when they instruct us to do certain evaluations in certain areas of the body. Any questions? Not difficult, right? Let's talk about the superior, inferior, and the middle. And you're gonna see how this plays out with these new suffixes that we're gonna use here. We're gonna use at, AD, AD, because we use already AL, pertaining to. But this changed the whole dynamics because AD, even though there are two words that I told you, if it has you two words or this or that, you can, oh my God, what is, oh, it's right here. So let's use this. We can use medial, AL, or mediate. See, that is difficult when you're not familiar with these terms. Cephal, cephalic, or cephala. AD. So AD means towards. See, right here, AD means towards this location. I'm moving towards this side, to this direction. So Mary means medial or middle, as it says right here, middle. So towards the middle. So we're moving something towards the middle. If you see something starts from the lateral part and it moves towards the middle, towards the center. That's what it's telling you. And we know that the line that divides the body right in the center. So we can differentiate between lateral side, left or right, but that line means the middle because it's dividing the body in equal parts in the middle. So now we have AD. So when we pronounce it, we're going to say mediate, cephalat. It ends in AD. And AD means towards, moving towards that direction. If it is cephalat, it's moving towards the head. See? It's right here. Oops, it's right here. Cephal, head, at, towards the head. So something moves towards the head. But if it is towards the middle, then something is lateral, is moving towards the middle. Or if something is moving to the inferior part, let's say to the feet, then we can use caudal, which means tail or inferior, towards the tail. See? Towards the tail. So remember, we always start from the suffix, moving to the word root. That's how we are going to understand these medical terms, seeing them one by one and making sure that we're not gonna get these medical terms, mixed up. Not gonna confuse them. Medial, AL, is not the same as mediate. So one is towards, the other one is pertaining to. So be careful when you have to find the define the definitions. Not to make sure that you're not going to confuse them. Okay, so let's put these word roots with using directions and their suffixes. We cover, I believe, all of them. We're going to use it once again. So we have here anterior. Remember, anter is the word root. The medical term, the entire medical term is anterior. It means pertaining to the front. Here it says AD, separated, caudal, towards the tail, towards the lower part, towards the inferior part. Here we have AL instead of AD. Remember, this is the suffix. So let me kind of put it in a different way. I'm gonna mark all the parts so we know that we are learning how to divide these terms. So let's talk about anterior. So for anterior, we're gonna use, remember, this is the suffix. We always need to mark them, and this is the word root. Anterior, word root, and the suffix. Here we have the next one. Oh my goodness, this, I don't even see this little point. So, okay, here. AD, this is the suffix, and code, this is the word root. Caudal. Remember, this is what we have to do with every single medical term. To divide a medical term on its parts and name each one of the parts. What is it? What it means? Under, front, IOR, pertaining to the front. Coat, lower part, inferior part, tail, AD, towards the tail, towards the lower part. Now we have caudal. Remember, we're not gonna mix them up because these are totally different terms. So this is AL. This is the suffix. And this is the word root. We know already that is the word root. But this AL means pertaining to the tail, pertaining to below. That's how we are going to manage these medical terms. We need to make sure that we do understand the parts of the medical term. So we have two. We're always going to divide it. Word root, the suffix. Do we have here combining vowel? No, we don't. If we don't have a combining vowel, we're not going to have a combining form. Because in order to have a combining form, we have to have a combining vowel. Do we have a prefix here? No, we don't. So we only have two parts because medical term can be made of two parts, word root and suffix. That's it. Everything else, from then on, we can have more parts, but a simple medical term can have only two parts. It can go up to 5, remember. Let's talk about cephala. We're going to add AD. Right here, AD is the suffix. Remember, we're going to always write down, and the word root. AD means towards. Cephal means head, towards the head. Then we have the same word root below. Cephal, IC. IC is the suffix. And cephal, of course, is the word root. IC means pertaining to the head. That's it. Simple. Then we're going to have distal. We know already that AL is the suffix. So we're going to separate suffix, and this is the word root. Pertaining to, far away. Pertaining to, far. That's basically what we're going to do. Very simple. Then we're going to have dorsat. AD is the suffix. Dors is the word root. So AD means towards the back. Below, we're going to have something that's very similar, but it means something else, because remember, when the suffix is different, changes, the meaning also changes. Dorsat means towards the back. Dorsal, on the other hand, AL, which is the suffix, means pertaining to. Dors, back, which is the word root. So, pertaining to the back. Last but not least in this slide, inferior. So we have IOR, which is the suffix, and then we have infer, which is the word root. IOR means pertaining to. IOR means pertaining to pertaining to, see, pertaining to. All these means pertaining to. IOR, AL, IC, pertaining to. AD, towards. Pertaining to the lower part, inferior. So that's how you need to interpret this. So little by little, you're getting familiar with these medical terms, and most importantly, trying to figure it out or breaking down each medical term and its parts, and to know how many parts this medical term has. The ones that we already covered only have two parts: suffix, word root, and the suffix. Because remember, in order for me to have a medical term, at least need to have two parts. And one of those parts has to be the word root, because it's the main foundation of the medical term, is the main term, and the suffix, which is, once again, a condition. And we have here a direction. Pertaining to is the direction. It pertains to the front. So it's giving me more details about the anterior part of the front part. So that is how these medical terms, we're going to work with that. Every single time that you see a medical term, divide it in its parts, and then identify each one of the parts. I know that at the end of the medical term, there is always going to be a suffix. So that gave me like a little indication of how to divide these medical terms. Let's continue with this using these medical terms that we already learned. So here we're gonna have, oh my goodness, lateral. AL is the suffix. Later is the word root. Lateral, pertaining to the side. Remember, you cannot say pertaining to the latter. It doesn't work that way. Then we're gonna have mediate, but I also have medial. So pay attention to the difference between these. AD, this is the suffix. Media, or medi, this is the word root. Oh my God, what am I going to do with this? This is the word root. This is towards the middle. Then we have the bottom one, it says medial. Don't mix them up. Mediate and medial are totally different definitions because the suffix is different and it's not pertaining to all of them. So we're gonna see right here, oh, I'm sorry, it's AL, which is the suffix, and medi, which is the word root, pertaining to the middle. Then we have posterior, IOR, oops, this is the suffix, and poster, this is the word root. Some of the literature, some of the textbooks, you're gonna see WR, word root, but there is no need to write down, just R for root. So you don't have to kind of crowd all these, but if you see WR is word root, you don't need to. But if you see it written there, this is the same. Word root or just root means the same. Here we have proximal. AL is the suffix. Proxim is the word root. Pertaining to near, pertaining to close. Then we have superior. We have seen these several times already. So we have IOR, the suffix, super, the word root, pertaining to the upper part, pertaining to above. Now we have this one that is less common, that you just learned it, AD, suffix, towards, venter, which is the word root, ventra, towards the front. Remember, ventrat or venter is front, anterior. Now we have same word root, but with a different suffix. So this will be AL, pertaining to the front. This is the word root. So you gotta get used to all these terms, dividing them, and it is word parts, so you can have the correct definition. If you messed up with any of these suffixes, or the word root for that matter, then the entire medical term is gonna be incorrect. So we need to kind of understand which one of these parts mean what, each part means what. What is the definition? So we can use them correctly. Okay. Chest x-rays again, because we're using the anterior part and the posterior part. This chest x-rays posterior anterior, antero-posterior views. See, when we go to the doctor, if it is left or right, it's a lot easier. But if the doctor asks you, I need a PA view. Oh, wait a minute. I need an AP view. That's a different issue. That's when we don't know what to do, because it's very different. This view right here, the first A view, or what am I looking? A view. Here, this is an PA. And this is an AP. This is anterior posterior, and this is posterior anterior. So you need to know how to interpret that, and for your exam as well. So how do we know that this is anterior posterior or posterior anterior? Depends of the light. See, this light that is going to be entering the anterior part first is where it hits the light. So this will be anterior, posterior, and posterior, anterior. So we don't focus on where is, what part of the back we are getting here is from where the light enters. The light enters to the anterior part, so it can reflect the posterior part. It's like the upside, it's like the reverse. That's what is called anterior, because the light enters through the front. Here, the light enters to the back, see? For that reason, P is first, because it's posterior. It's not where the film, or what is it that we are going to be making a picture, if you will, what image I want to record? Well, yes, I need this part of the chest, the anterior part of the chest, but the light enters through here, and that's what it counts. So that's like the needles. The larger the gauge, the smaller the needle. So this is the same. If I said AP, is because the light enters to the chest, to the anterior part, to the ventral part. So that's what we have here. Posterior, see, posterior, anterior. This is the projection because the projector, the light enters from the posterior part, which is this one, letter A. The other one is anterior posterior. Why? Because the light enters to the anterior the anterior part of the chest. But what I really want is the back of the lungs. Here I want the front of the lungs. That is how these X-rays positions are so important. The doctor can say, I need an AP. That's it, only one view. Can say lateral right, lateral left, an oblique. I need all the views. Well, if I need all the views, I have no problem with that. But if I'm only being asked about one view, AP or PA, and if I take the wrong one because I didn't do it the right way, I didn't position my patient correctly, then, you know, the patient might have the results that I didn't ask for. And we have to call the patient again. And the insurance probably is not going to pay for that second view because you did it wrong in the first place. So directions are very, very important. How we place the patients to do certain exams, certain evaluations, to denote certain abnormalities, we got to follow directions. This is like when we move in the city. You have to have a direction where you're going. But here in the medical, you have to have the details. So we know exactly what is it that we're looking for, where, what part of the body I want to see, what part of the body I suspect that you may have something serious. And remember, we don't order all the views because sometimes it's not needed and the insurance do not pay for all of those. So we need to focus on those who are really matter and do the things right the first time. Any questions? Let's talk about body planes and sections. Body planes are very important. At least one of these body planes are going to be asked on your national exam. I will ask on my exam because I know that you're going to have it, you're going to encounter on your exam. So I want to make sure that I don't leave this out. So when we do a dissection of any organ or the body, we use planes, use sections all the time. So we kind of draw imaginary lines that we call planes. And that's how we are going to do surgical procedures, repair certain structures or organs, because we follow directions. There are three major body planes. We have here the sagittal or mid-sagittal plane. Remember, those are called planes. Sagittal or mid-sagittal. Remember, sagitt usually means sides. Learn it from me, sides. Sagittal, sides, dividing the body into sides, whether right and left. But when it says mid-sagittal, we are dividing the body into equal parts because it's mid. We cutting the body right in the middle. See, that is a difference. Let's go to this image right here. Here, the body is divided into equal parts. Why? Because I'm dividing the body right in the middle. So this will be mid-sagittal. Let's say that I do not divide the body in the middle, but I'm going to divide the body in sides. So I'm going to divide the body right here. I'm dividing the body in sides, but it's not in the middle, not here. So the parts are not equal. So if the parts are here, the parts are equal. This side is equal to this side because I divide the body in the middle. So that's what is called mid-sagittal. If I divide the body in two equal parts, it's called mid-sagittal. Remember, mid means middle. But if I divide the body when it's not equal parts, it's called sagittal only. I can divide the body right here, or I can divide the body right here. It is part of the body that I'm dividing it, this part from this part. But it's not equal parts. For that reason, it's called sagittal only. Did you guys understand what I'm saying? The difference between sagittal and mid-sagittal? Yes? Hello?
Yes, Mr. Hoyo?
Yes.
Yes. So, do you understand the difference between mid-sagittal and sagittal?
So sagittal could be dividing anywhere, any part of the body, but mid is right through the middle.
Correct. One is equal parts, two halves. The other one is not equal. So if you have a question, they ask you, the body is divided in two equal parts, right and left. That will be mid-sagittal, right? But if they only mention that the body is divided in right and left, if you have within the multiple choice mid-sagittal and sagittal, the right answer will be sagittal, because in order for being mid-sagittal, you have to have that the body is divided in equal parts, or it is divided right in the middle, or the body is divided in two halves. Remember, two halves means two equal parts, because that's how they like to use in the text. Thank you. So you guys do understand that. So let's move on with the second one. So here it is, sagittal or mid-sagittal. So this is how it works. Sagittal, remember, is just that the body is divided in two sides. Sagittal. remember the S, sagittal side. Don't mix them up because the other terms do not have an S to begin with. So if you see, this body is divided into equal parts right here. So that means that this is mid-sagittal. See? It's divided right in the middle. Mid-sagittal. But if it was divided right here on the covered part, but it's not the middle, then you call it sagittal. So forget about an imaginary line passing here. No, this is a dividing the body, see, into right and left portions or sections. It can be equal sections or just dividing the body in two sides. Remember, it has to be right and left, because we're going to have another one that is superior and superior inferior, and another one that it is front and back. So we got to make sure that we do understand what is it that the body is being divided into. Because if we are not understanding that part, then, well, the answer is going to be incorrect. And I don't want you to get the incorrect answer. So if you understand sagittal, remember S for sides. Most of the time, they give you mid-sagittal. So as soon as you see the body is divided, and right and two sides, right and left sides, immediately you look for the answer, sagittal, sides, sagittal. If they said equal parts, two halves, that's mid-sagittal. Then you look for mid-sagittal because they're giving you more details. Good. Frontal or coronal? Let's talk about this one. Now we're going to move to frontal and coronal. The second one. As the word implied, remember frontal. So I use this part to differentiate in between the other planes. This means that the body is divided into anterior and posterior, ventral and dorsal, or front and back. We're going to see that. Here we see it. Once again, this is an imaginary line that divides the body, right here, divides the body into anterior and posterior parts. So as soon as I see anterior, front, and back, I know that this is the frontal. Now, sometimes they use the other name that is known as coronal. But what is coronal? Coronal is the cranium, the head. So the head is divided. See, coronal plane is divided from here, completely do the same. So we separate half the front here and the back here. So we have half of the body, the front and the back. Pay attention, because in the questions for the exam, you can have a little kind of twist, if you will, when they are kind of building those questions for you. So instead of saying the body is divided into anterior and posterior portions, they're going to say the body is divided in, face and back, face and shoulders, or chest and the shoulder. So you know that the face is in the front. You know that the breast of the chest is in the front. So that means coronal or frontal. That's why I'm giving you all these hints, because that's how they like to throw those questions in there. You know what is anterior, but if you forget what is the anterior part, everything that is in the anterior part, the face, the chest, the abdominal part, the inguinal part, the front of the legs, the toes are in the front. Remember, this is the anatomical position. So we're going to see everything that is in the front. And on the other side, we mention the opposite to it. Usually is the back, the shoulders, the nose is in the front. So they can use any of those, but that is supposed to be like a hint that they give you. It's just that sometimes we are not kind of prepared for those kind of questions, because we think that every single question is supposed to be straightforward question. Unfortunately, it's not like that. Sometimes they use some other characteristics of the body to kind of, change the wording a little bit. So that will be frontal coronal. But most of the cases, they ask you, the body is divided into anterior and posterior. Then immediately you know anterior is front. But remember, that can also be called coronal. Okay. Any questions? Let's move on to the third one. Transverse or horizontal. Now you see that these planes are totally, completely different. The body is divided, but it's divided in different fashion. So let's go to the transverse. Here it is. Very simple. So the body is divided into superior and inferior portions. Simple. But this is called transverse because this is a transversal line. But it's also called horizontal because this is a horizontal line. The body is not divided in equal parts. It doesn't matter. It can be divided right here. It can be divided right here. It can be divided. It doesn't matter. But it is in a transversal way or horizontal plane. That's how it is. You see? Definition: horizontal fields dividing the body into upper and lower portions. What is the upper part? Superior. What is the lower part? Inferior. The body is divided in inferior and superior. Upper and lower portions. I've never heard anything that they're going to give you, oh, the body is divided into cephal and caudal. They're not going to say that. It's got to be superior, inferior, or upper and lower portions. But you do need to know that this is the transverse or horizontal planes. So get familiar with these planes because they like to ask about this direction. Medical terminology is usually common, very common on medical exams or certifications. So we need to be familiar. So we're done with the planes. Remember planes, sagittal or mid-sagittal, frontal or coronal. Remember, frontal or coronal means the same. Sagittal, the difference, one is in the middle, the other one is not dividing the body in middles. The transverse and horizontal is the same. Transverse, we can call it transverse or horizontal. That's basically what I want you to remember, because these are hints for you, or little tips to you, so you differentiate them very easily. I make this PowerPoint, I add these images, because the PowerPoint presentation doesn't come like that. It comes with one picture. Then they show all these together. It looks like a revolving door. And you're kind of confused. What is that? I said, oh, wait a minute. What is it? I know this, but when I see it, I said, oh, well, if you see all these planes in one image, it's going to be very difficult to differentiate which one are you talking about. So I place them individually so you can kind of grasp these images, because remember, sometimes looking at something is a lot easier just to remember definitions. So that is my concern, that you get this right. Okay, let's talk about these abdominal regions. So before we start with the definitions, let's move to the image. So let's put the image first, because I like this better. So definitions, let's move this here, because when I was doing the sagittal, I explained first sagittal, then frontal, and then coronal, transverse. So it's better to go in order. So let's do this first, so you understand better by looking at the image, and then we talk about the definitions. It says the abdominopelvic regions. There are 9 abdominopelvic regions. 9. So I'm going to put it right here. 9 abdominopelvic regions. That's how we're going to know the difference, because we're going to have later on in this chapter quadrants, but quadrants are 4. So just in case you have a question when they ask you how many abdominopelvic regions there are in our body, you said 9. We're going to mention them. So we have right here 1. Oh, let me put this different color. Let me do green right here. So we have 1. We have number 2. This is number 3. This is number 4. This is number 5, right here in the center. Number 6, number 7, number 8, and number 9. See? 9 regions. Not quadrants. Quadrants means quadrants. Cuatro. 4. So we have 3 superior, 3 in the middle, and 3 on the inferior part. So remembering these names is not going to be easy. So we somehow need to memorize them. But I'm going to mention more likely what will be the key points from these abdominal regions that you will be asked on an exam. So most of the time, that is what I want you to tell. So let's clean this, and we're going to start with these regions, one by one. So in order for us to understand these regions, we're gonna start with the middle one. There is always is easy. The middle one, the umbilical region. I like the umbilical region because it's in the middle, it's in the center. So I'm gonna start with the umbilical region. See, it's all this area. Now I'm going to move up. What do we find right here in the umbilical region? We're gonna find the intestines and we're gonna find part of the stomach. If you see right here, this is the stomach. So umbilical means the belly, the umbilicus. And the umbilicus is right there in the middle. This divides the body in the middle part. So we're gonna have superior and inferior. For that reason, we use the umbilical. Now, if you look above the umbilical, it says epigastric. Here it says epigastric. What is epi? Epi means above. What is gaster? Stomach. What is IC? Pertaining to. Pertaining to above the stomach. So if we use the umbilical, because it will be a lot easier if they will give us a different take on this definition, right? They will say epiumbilicus. Oh, that would be nice. Because that would be says, oh, that's above the umbilical. But we don't have the medical term. So for that reason, we use the stomach, that it is part of the stomach located right here on the umbilicus. So we're gonna use epigastric. Right above the umbilicus, we're gonna find the epigastric region. Remember, epi means above, gastric means stomach. Now, then we go below. Here, we're gonna set hypogastric. Remember, that will be this quadrant. It is hypo. What is hypo? Hypo means below, below the stomach. So we use the umbilicus as reference, something that is above the stomach and something that is below the stomach. So epigastric and hypogastric. Now we're gonna use the same umbilical area to mention the sides of the umbilical region. Then we have the right lumbar region and the left lumbar region. Why do they give you these names? What do you mean lumbar? Right and left, we know that is the right side and the left side. Lumbar, because this is the lumbar vertebrae, the lumbar region of the spinal cord that is located right here in this area. Of course, right here in the middle on the back. But we're gonna denote this right here. So that is called the right and left lumbar. These 9 regions are a little complex. So because there are 9 of them. And then you're gonna have all these names to the right, the left. But do not worry, because they're not gonna ask you about the left lumbar. They're not gonna ask you about the right lumbar. They're gonna ask you about the epigastric area, because the epigastric is above the umbilical, and the umbilical is very important. So the umbilical is the main landmark. So they're gonna ask you, what is umbilical referring to? So then you're gonna look for belly. That's it. So that's the umbilical area or region. Now we can take the epigastric or the hypogastric, whichever feels comfortable with you. So I'm going for the epigastric. So you're going to have right and left, but not right and left epigastric. We're going to have hypochondria. Right hypochondria. What is chondria? Chondriac is the ribs. So right here we have the right hypochondria because it's below the ribs. Hypo, below, chondriac, ribs. So right hypochondriac, left hypochondriac, because we have the two sides of the chest, right? That's it. Then we're going to go to the hypogastric, right and left, because all of them has right and left, but different names, depends on the location. Right iliac, left iliac. Why do we call it? Because these are the major bones of the hips. These bones that we can touch right here by the hips, those are called iliac. Looks like ears. So that will be the iliac. So we have the right iliac right here and the left iliac right here. Of course, they are up here, so they are too far up because the hips are starting right here. But this is the lumbar. So the hips are right here, not up here by the belly. So that's basically what it is. So that will be the right and left iliac because the iliac bone are these hip bones, the big ones that looks like, once again, big ears. So that's how we are going to kind of remember this. So remember, know the umbilical region, how many regions, and what is above the umbilicals, the epigastric region. That's it. Of course, we have different names for certain areas in medicine, but these are the medical terms that they use to describe these abdominal regions. So we're going to go back to the lecture. Oops, right here. Number of regions indicated in parentheses. So that's what it's telling you. We have 1, 2, 3, 5, 7, 9. See? 2 iliac regions, one on the right, one on the left. 2 lumbar regions, one on the right, one on the left, because that's what it says right here. 2 hypochondriac regions, one on the right, one on the left. We have 1 hypogastric, we have 1 umbilical, and we have 1 epigastric. So right here it says umbilical. The umbilical region is the one around the navel, or the umbilicals. Epigastric, above the umbilical region. But it's not going to say above the umbilical region, it's above the stomach, because that's what epigastric means. But they can ask you above the umbilical region, what do you find? The epigastric region. Below the umbilical region, what you're going to find? The hypogastric region. Now, the right and the left. But the right of the epigastric and right and left, you're going to find the hypochondria area. Remember, hypo, below, chondria means the ribs. The lumbar regions, right and left of the umbilical regions. And the iliac, right and left of the hypogastric region. So that is how we are going to remember this, is to get familiar with the main landmarks of our body, particularly the anterior part, And then we're gonna be able to understand and be able to find the right definitions or the right answer for the questions that you are going to have. So the regions usually are not asked much. But keep in mind that there are 9 regions, and the region by the umbilicals is, remember, umbilicus or the navel or just the belly, remember, layman terms. So that's how you are going to understand. Above the navel, above the belly, what is that region? Oh, epigastric region. Below the belly, hypogastric. That's usually what they ask. The other ones, they don't ask because it's very complicated and we don't use them much unless you're a doctor and you have to, mention all the areas or the structures that are within these parts of this region. Because the regions were draw this way because we need to know what is underneath them. That's the purpose. What is the liver? So here is the liver. What is the stomach? What is the pancreas? Where are the intestines are? But it's a more detail. Why? Because some of these organs within the abdominal area and the pelvic area, they are sharing different regions. So this is like more specific regions or distribution that we use versus the one that I'm going to talk about later on, which is the quadrants, which is more commonly used. Instead of using the regions, we're going to use more the quadrants. This is more like for more specific purposes, more details. Any questions about the abdominal pelvic regions? Remember, pelvic is when we find all the urinary and reproductive organs. Abdominal, when we find most of the organs of our body, which will be, remember, the liver, the pancreas, the stomach, the intestines. We're not going to find the lungs there. We're not going to find the heart. They will be in the chest area. So this is the abdominal area. Okay, so let's talk about the quadrants. These are this diagram or this table is usually most commonly used than the abdominal pelvic regions. So here is more like a generalize. Once again, we're going to start with the umbilicus again. Now, if you look here, I'm going to divide the body right in the middle, passing through the belly, and then passing through the belly. So we know that this is the right side, this is the left side. This is the right side, this is the left side. That's a lot easier. The quadrants are easier because it's only 4. But the names that they use are easy to memorize, easy to remember. This is the right upper quadrant. It's the right upper quadrant, see? This is the left upper quadrant. Left upper quadrant. This is the right lower quadrant. Very easy. So this is the left lower quadrant. So 4 quadrant. Now, questions that you have. Pay attention to this because these will be questions for your exam. You need to know what R, U, and Q stands for. Remember, right upper quadrant. The names are U, L, U, and Q. What it stands for? Left upper quadrant. Because they're going to give you these acronyms. What does R, U, Q stands for? And then you look for the answer. Right upper quadrant. Left upper quadrant. Right lower quadrant. Left lower quadrant. Very simple. So that's why quadrants usually are asked more than the regions. Why? Because they are easier. We use it most commonly. So more frequently. And medicine because it's a lot easier. Because just kind of focus on the entire organ in this particular area. So questions that you will be having on your exam. In which quadrant you find the liver? See, the liver is on the right upper quadrant because it's mostly on the right. See? Right upper quadrant, the majority of the section of the liver is on the right upper quadrant. They're gonna ask, where is the stomach located? Which quadrant? Left upper quadrant. Why? Because most of the stomach is on the left. One more question. Where is the appendix located? The appendix is located on the right lower quadrant. This is the appendix right here. Because the appendix is a little protuberance that comes out the large intestine. And this is the one that sometimes, due to an infection, got swollen and has to be removed before it bursts open because that can kill the patient. So there are 3 things that you're going to be asked about these quadrants, remember. 4 things. What are the acronyms stands for? What is the liver? In which quadrant the liver is located? Remember, right upper quadrant, liver. The stomach, left upper quadrant. What about the appendix? Right lower quadrant. That's it. Simple. Simple. Why am I telling you this? Because I don't want you to kill yourself trying to read every single detail, trying to memorize every single quadrant and which organs are in this. No, the most important thing is that. See, when we evaluate, we know that most of the intestines are in the lower part, whether right or left. So that's basically what it is. Most of the other organs are on the upper part, whether right or left. See, in this area, we're going to have the liver, we're going to have the stomach, we're going to have the pancreas. Now you might say, oh, wait a minute, professor, I don't see the liver. Oh, the kidneys. You don't see it because the kidneys are on the back. The kidneys are not part of the abdominopelvic quadrant. They are outside of these organs. They are outside of the peritoneum, which is the membrane that protects all these. So once again, that will be anatomy and physiology. For now, the quadrants. So remember in which quadrant is the liver located, in which quadrant is the stomach located, in which quadrant is the appendix located, and what does a RUQ, LUQ, right LQ, and LLQ stands for. Because that definitely is going to be questioned for exams. Any questions? Okay, let's talk about some abbreviations. Abbreviations are very important, and then we go on break. Abbreviations. Remember, abbreviations are different from acronyms. So here we have acronyms and abbreviations, or it says they are directional terms and quadrants. So let's start with the first one, ANT or ante, anterior, AP, anterior posterior, INF, inferior, me, medial or median, lat, lateral, pulse, posterior, PA, posterior anterior, soup, it's not the soup that we eat, because that would be wrong spell, superior. Now we have all these quadrants, see? We need to know the quadrants. Right upper quadrant, left upper quadrant, right lower quadrant, left lower quadrant. See, it's not difficult. We just need to get familiar with them to know that we have quadrants, that we have the regions. Quadrants, quadrants means quattro, means four. Good. Let's do a little pretest and see if you can answer this. So I'm going to give this to you. So when we come back from break, we can solve these. You tell me later on, read it and tell me, select the correct question. There are 5 pretest questions. Let's see if we can get this. Okay. All right. So let's take 25 minutes break and then we come back. So it is 7:18. Let's say that is 7:20. 7:45, we come back. Okay. We're gonna go on break. 7:20, 7:45, we are going to come back.
Okay.
All right, enjoy, guys. We deserve a little break. Bueno, welcome back.
Hey.
Hey, teacher.
Okay. So, I hope you guys enjoy your break because I did mine. Yesterday, I didn't enjoy anything because I was all caught up with this application, but today it was better. I have the chance to go eat something at the meantime. Okay, so today we're not gonna finish as late as we did yesterday. From now on, we're gonna leave like around 9. Okay. So around 9, we're gonna finish classes, and that's it. Everybody goes late, goes to rest, to do something else. Now, one more announcement. Remember, we don't have classes on Friday. Okay. It is gonna be Monday to Thursday, no Friday classes.
Oh, thank God, Lord Jesus.
Oh, well. I remember that I mentioned it.
Yes, I remember.
Yeah, that I was going to talk to the director, I mean the owner, and see how can we arrange this. This is too much because I do have weekend classes, and that's too much for me also. Finish here and then on Saturday, Sunday class. Oh no, too much. So at least you can have a day there that day off that you can use it for whatever personal or medical issues that you might have for family. Who knows? All right. So that was something that I was have planned in advance, and thank God we can do it. Okay, so let's answer these pre-tests. Remember, if you don't know the answer, just give me anything that you might think. You have plenty of time to do it. Okay, question number 1. The anatomic position could be best described as
C.
A, B, C, D. So do me a favor. Each one of you send me by chat the letter. Don't tell me because the other ones are going to copy from you. I want to make sure that I know exactly what you guys thinking. So if you use the chat, so you can just send me that. Just the letter said, oh, A, B, C, O, D, and then I know. Okay. Seems like everybody's kind of on the same boat. Okay,
Where I'm
so
supposed to be writing this at?
say what?
I don't know where I'm supposed to be writing my answer at.
All right. Remember, it says right there, the anatomical position. Remember, the anatomical position is when we are standing erect, facing forward with the hands facing forward with the feet a little separated. So that will be reference point when using directional terms. Letter C. So for those who answer letter C, you guys are correct. If you didn't get it right, now you know which one is the right one. Got it? Congratulations if you get it right. If you didn't, no worries. That's how we're gonna learn. Number 2, in the medical term medial, the word root means what? Remember, you sent me by the chat. So let me break the word. So I want you to make sure that you know what you're doing. Medial. AL is the suffix. Medi is the root. So what is the word root means? That's what it's asking you. I'm helping you out because I want you to do well on this later on. Oops, it's going right here. Waiting for the answers.
We put them in there.
Oh, you guys did. Oh my goodness. What happened? That is a coincidence, right? And it's being C again. Yes, correct. Letter C. See, that's not difficult. It's just that we need to go over things and then you can understand how this works. Number 3.
Professor, I have an observation about question number 2.
Go ahead.
You see where when you broke it down, that's when I read the word root in the question. So like for future reference, we should really read those questions, because if it would have
Right.
said like something else, it would have been wrong.
Right, that's what I'm saying. You see, you have word root. The word root means, so the first thing that you have to do, as I mentioned it before, is to divide the medical term. So you know which one is the word root, what is the prefix, what is the suffix, because that's what they like to ask. They give you a medical term and they said the prefix in this medical term means what? The word root means what? Which is the combining vowel? Which is the combining form? So they just give you the word and you need to know how to break it down so you know what part is it that they want you to give the definition. Got it? But good. It was relevant. Number 3. Pay attention to this because this is a little more tricky. Imaginary flat fields uses points of reference used to identify all parts of the body are. Oh, wait a minute. What am I reading? Imaginary flat fields used as points of reference used to identify parts of the body are called. Remember, imaginary flat lines. We're not talking about ba. Oh, I almost tell you. Let's see how many of you get it right. Okay. Okay. If you got B, that is the correct one. Now, let me explain you why is this a little more tricky than the other ones. So be careful with this because a little something. Remember, the only one that has imaginary lines that divides the body in left and right, superior, inferior, it will be the anatomical planes. The quadrants do not have imaginary lines. We know the lines where they go and they divide in quadrants. Remember, regions. And it's not the anatomical position because that's not what they're asking us. So again, the abdominopelvic regions, they will set which region, which quadrant. The other one, it says anatomic planes. And the planes are the only one imaginary lines. Is that understood? So pay attention to that because that is how we kind of identify the right question. So the correct answer was B. Okay, number 4. The area around the navel is considered which abdominopelvic region? See, now it specifies that it is a region. So answer which one is called navel. Oh my goodness, easy, right? I hope everybody got this right. Awesome. Yeah, you guys right. But you got it right. It's A. Umbilical. Remember, umbilicus, navel, belly, but it's a region. So we know That's how it works. Now you understand it more likely how are they going to state these questions, because that's the most important part, the wording that they use. Okay, one more. Number 5, the abbreviation for the medical term referring to the right upper quadrant. Oh my goodness, this cannot be, can this be any easier? So let's see, everybody should get it right. Right upper quadrant. Okay. If you selected letter C, that is the correct one. Remember, right. Oh my God, what am I? Here, right upper quadrant. That's the one that you need to answer correctly. The other ones is left upper quadrant, left lower quadrant, and right lower quadrant. So the only one, right. See, they give you all the letters. R, right, U, upper quadrant, Q. So it should be no issue for you to get these answers. Kind of nice, right? Okay,
Mr.
so
Hoya,
go
I know
ahead.
this kind of off topic, but do you know like a website where I could take the practice test
Practice tests
for
for what?
the state medical
The
assistant?
national certification.
Yeah.
Okay. The practice test that the National Healthcare Organization, the one that gives you the exam,
Mhm.
they're gonna charge you like $60, $40, I don't know, for it.
For the
And
practice?
for practical, yeah, practical tests.
Okay.
But I don't know.
Thank you. I appreciate it though.
Yeah, they have like a lot of, or you can go online, just Google and type there medical assistant NHA. I'm gonna write it down right here.
Thank you.
NHA. Oh my goodness, these letters are weird. It's NHA. That's the organization that gives the exams that you're gonna take, and you're gonna look for CCMA practical exam. Okay? So when you go CCMA NHA practical exam, they know that this is the certified clinical medical assistant.
Okay. And
Yeah.
what's the first one?
Oh no, that's the organization that gives the
Okay.
exam. So you have to explain that this is the CCMA from this organization.
Okay. Thank you.
And no problem. And they're going to give you lots of tests there from different versions, different times. And just for you to have an idea, the type of question that you will get. Is that understood?
Yes, I understand.
Yeah. Remember that if I'm still with you guys to the end of this course after you finish the internship, I'm gonna talk to the owner of the school, Mr. Lawrence. I'm planning to do a review class for the exam. So that will be like maybe 4, 5, 6 hours review class. So we can meet at the school, go over a bunch of questions that more likely tend to come on the exam. So you guys are prepared. Got it?
Got it.
Okay, but at the meantime, you can read questions. The problem with these review questions are that they show you a bunch of tests that no longer are, being asked. So you're gonna go crazy reading all these questions and try to answer all these. And at the end of the day, you read too much and not many of those questions are gonna come on the test. So I just don't want you to get stressed out reading and, packing and all those things, stuffing all this information in your brain. And at the end of the day, not many questions from there you're gonna get. But the ones from the NHA, which is the National Heart Associations, that is giving you the test, then they give you more likely what it's gonna be. Not exactly, but they're gonna use kind of, they change the wording. Yeah. Any other questions? Okay, all right. So let's move on to the next chapter. We're not gonna finish it. We're just gonna go over some basics. Remember, we're gonna finish at 9 p.m. So we have 1 hour to cover some of these slides. Can you see the new chapter?
No.
Okay. So you're not seeing the integumental system, right? You're not seeing it.
No, yeah. We still seeing the last question we answered.
Okay, no problem. Let me go right here. Let me. Now you should be seeing it, the new one. It says introduction to the integumentary system.
Yeah, we see it. It got the hair follicle.
Yes?
Yeah.
Excellent. Okay. I'm getting the hang of it this because yesterday was a disaster for me. But well, finally we get through. Okay, so when we talk about integumentary system, see, this is another medical term that you need to understand. This means skin. Integumentary system means the skin system. But we add some accessory organs like nails, hair. So those little things here and there, some sebaceous glands, some sudoriferous glands. If you guys have taken anatomy and physiology, you know what I'm talking about. If you haven't, no worries, because I will be teaching that class. I believe it will be next after this module. So once again, this is mostly the skin. So we're going to talk about medical terms related to the skin, to the hair, to the nails, to these glands that produce sweat and these glands that produce oil or the fat that we have, like this greasy kind of sensation outside of our skin. So that's basically what we're going to talk about. Probably some nerves, some blood vessels, not much about that, but mostly it's going to be related to the skin because the blood vessels will be related to the cardiovascular system. So let's talk about the functions of the integumentary system. Very important to know functions of the systems because sometimes exam questions are based on what is the function of this system? What is exactly the integumentary systems do? How do they protect our body? So it says right there, number one, it protects our body from harmful or against harmful environmental elements. How's that? Remember, the skin is like this barrier on the outside. So everything that needs to get inside our body, it got to pass through the skin. And that's not easy. A mosquito do not go directly into the heart, the lungs, the stomach, the kidney, the liver, the pancreas, the intestines. They don't go inside and beat us and make us sick. No, they stick our skin or they bite our skin. When you have a blow to your body, you fall, somebody hits you, somebody throws you something, something is spilled, whether it's cold, whether it is hot, whether it burns, it goes through the skin. So can you imagine without the skin, every single thing will go inside. Can you imagine rain? Oh, it's raining. I'm gonna get inundated. I'm gonna be floating inside water because the skin is not there. So the skin protects you against dust because the dust gets trapped outside on our skin. It doesn't go inside. So that is called harmful environmental elements. Anything that can cause you to be sick or to damage internal organs, the first part that is getting the heat is going to be the skin. That will be number one. Another function, prevents fluid loss. Well, within the skin, we have this interstitial fluid. And can you imagine without the skin, this fluid that is in between the cells, it will leak out our body. So we need the skin for that reason. And not only that, just prevent fluid loss. Remember when we sweat, these liquids, the fluids comes out through our pores. But that is because we need to, because it's a way of protection. That's like an air conditioning for our body. When we are hot, the body needs to get wet from the outside, and that's what we sweat to protect us. Number three, produces vitamin D. So most of the vitamin D that we use in our body is produced in the skin. But we need something else to make this vitamin D to be produced. We need the sun. So we need to be exposed to the sun, and that activates certain hormones in our body, certain proteins. So it can boost the vitamin D to be produced. That's how it works. Produces vitamin D. So one of the questions for the exam, it will be, okay, where is vitamin D produced? So then they're not gonna say integumentary system, it's gonna say the skin. So you're gonna look for the skin because that's what vitamin D is produced. It regulates body temperature. I already mentioned how it regulates body temperature. When it's cold, all these pores, they closes down. And that's what we have these goosebumps when it's cold. Because the skin is trying to become thicker and not allowing anything from the inside to escape. So it holds it inside. And when it's hot, it's the same way. We start sweating. Remember, sweat, it is a way of protecting our body because it's hot. We don't want this heat from the outside to enter the inside. Remember that there is an environmental temperature and there is a body temperature, which is totally different. So when we sweat, our body, what it's trying to do is regulate the temperature inside. Start kind of watering the skin so the skin cools down with the sweat, just like when we water our plants. We water the skin. So the internal organs do not get high temperature. because then you're going to collapse. You're going to develop heat exhaustion. That's basically what it is. Secretes waste. Well, the oily glands. See, whenever we have too much oil on the oily glands, we need to remove them. So we secrete it. We take it out. Certain secretions, vaginal secretions, are secreted through the skin. So the sweat, see, when you sweat and these bad odors that comes underneath our axillary line, on our groin area, or in our feet, all that are secretions. That's what they don't smell good, because they are secretions from the body, needs to be released through the skin.
My teacher, he said no school Fridays, and the meetings are going to be 5 to 9 now, not 5 to 10. I don't have like.
Hello, turn on your microphones off. So we don't hear what you guys talking outside. All right. Provide sensory information. Oh, wait a minute. What is the sensory information? Oops, very easy. We feel the touch. See, we feel heat. When the temperature is high, we feel it. When it's cold, we feel it through the sensors that we have in our skin. Temperature sensors, cold, hot, sensation. We feel when somebody touches us, when somebody hit us, when somebody beat us, or something beat us. So we have all these sensation receptors. That's what it's called. So we feel it. So when someone say that, oh my God, my arm is numb, and you touch it and you don't feel anything, that's like when put anesthesia on you. So it provides for this. So we feel things. We feel when it's cold, when it's hot, when somebody touches us. Oh, we're doing an examination and we said, oh, it hurts right here. So we're going to press over that area, and you might say, oh, it hurts more, or it doesn't hurt, or I don't feel it. So those are the sensory receptors. So it's very important for us. That's how we know that we have pain receptors. Once again, cold and heat receptors. So lots of receptors. Good. So knowing the functions of the skin, now we have an idea what it does. Then we're going to talk about those medical terms, those word roots related to the integumentary system. Those suffixes, prefixes that we're going to use for the same reason. Here we have some of them. Let's describe, pronounce, and give the definition for these medical terms. This medical term is a little difficult. You haven't heard it before. Probably you haven't heard, and probably you heard it, you probably forgot. Acro. Acro is a combining form. Remember, acre, A-C-R, is the word root in the combining vowel. So let's put it right here. This is the O-S, and this is the word root. So acre means the word root. O is, oh, I'm sorry, it's the combining vowel. What am I doing here? It's the combining vowel, so we can have the combining form. Remember, I don't use this combined vowel. So this is, the whole thing is a combining form. Combining form, CF. Okay, because when we say acre, that's kind of difficult to understand what is being said. So acro. So acro means extremities. Can you imagine acro means extremities. Remember, this is not English, it's not Spanish, it's Latin and Greek. So extremities. Later on, we're gonna learn some suffixes that we're gonna attach to it so we can find the complete word and the complete definition of this term. So for now, we're just gonna leave it like this so we do not kind of overlap certain other information that I have right here. And we don't spend too much time trying to explain this, because then we have to use the other term that I don't have it here, and then it will be difficult. Next one. Here we have cutane. Cutane comes from the word cutaneous, skin. So here this means skin, from cutaneous, from kind of not cuticular, but cutaneous tissue. So that's basically what it is. So this means skin. Gonna see it later on. There is another one right here, derm. This is one of the most common ones because you heard about this. Derm, that means skin as well. So cutane means skin, and derm means skin as well. Skin. Dermat. Dermat also means skin. See, derma means skin. See how many terms means the same, but we use them according to the context of whatever we are trying to convey. That's basically what it is. So cutane, derm, dermat means skin. Once again, later on, we're gonna add a suffix, and then we're gonna find the complete meaning of the medical term. Next one. This is another one that probably is a little difficult to remember. Mike or Michael. This means fungal or fungus. This is a fungus. Later on, we're gonna see how we are going to apply this word root plus the prefix to give a complete meaning to a word that is used very commonly when you have fungal infection in this particular part of the body. So we don't know the other part. It's not well known. So for that reason, I don't want to go into that until we find the other part. So we first focus on the word roots. So myco means fungus. Here we have, and the next one, we have onycho. Onic or onycho. Remember, this is a combining because we are in the vowel O. Onyx means nails. Nails. Can you imagine your nails? My nails are called onyx. So interesting. So right here, there are 1, 2, probably 3 terms that you weren't familiar with. Acro, myco, and onycho. Because these are not terms used often or commonly used terms. Only in medicine we're going to encounter these. But mostly when we are talking about infectious conditions, conditions of the skin, that's when we're going to find them. So let's now focus on colors. Remember, colors are important when we talk about the skin because the skin turns different colors. The skin can be kind of bluish, can be kind of purple or purplish, can be red, can be kind of orange or yellow, can be white. It can turn kind of white, your skin. So if we look at colors, right here, this is colors, meaning everything that we're going to talk about down here is referred to medical terms referring to colors. So let's talk about the first one. This is cyan or cyano. Remember? Cyan or cyano. This means color blue. Blue color. So blue color. Then we have eryther or erythro. This is color red. Red. Then we have leuco. Leuco means white. Remember, it's white. Color white. Melano. Oh, probably this, you never heard about it. Melano means black or dark. Dark or black, remember. Then Xantho. Maybe you never heard about this. Is Xantho with X, not Santo. The one, the image that you pray to. No, this is a Xantho. This means yellow. Yellow. This is yellow color. Yellow. We're going to have it later on. It's written there. So you need to know the colors, particularly cyano, erythro, leuco, melano, xantho. All these colors are important in the examination because they can ask you either or. Remember that you're going to have different versions of the exam. If you sit for the exam the same day, 3, 4, 5 of you, some of you are going to have the same questions, but some of the questions is going to be kind of randomly, selected. So you are going to have cyano, the other one is going to have erythro, the other one is going to have leuco, but you don't know which one you're going to have. For that reason, it is good to know all of them. It's only 5 colors. Blue, red, white, dark, or black, and yellow. So basically, that's what it is. So we're going to put these colors and these word roots. We're going to kind of have a medical term, and we're going to kind of define them, because that's the purpose. We're going to define these medical terms. It's important that you define them so you understand then what it means. Okay. Let's talk about suffixes and prefixes, because we're going to use these word roots, these colors, and we're going to add a suffix. Remember, the suffixes are always attached to the end of the medical term. So some of these are already known. Some of them, we're just going to get to know. Okay, iris. We did iris yesterday. So arthritis, remember, inflammation. Itis means inflammation. Osis. Osis means an abnormal condition. It is not condition, it's an abnormal condition. Then when we add it to the word roots, we're going to see an abnormal condition of what? An inflammation of what? OUS, O's. What do you mean? This is pertaining to. Pertaining to. Remember, if you have 1, 2, or 3 letters as a suffix, most of the time, 95% of the time is pertaining to. The other 5% is related to other definitions. Tommy, this is not your friend Tommy. This is not your belly. This is an incision, a cut. When we cut through something, that is called tummy. So we're gonna have, once again, examples of how to use these suffixes. So we're gonna have the word root, and then we're gonna have a complete medical term, and we're gonna define this medical term. For now, I'm giving you definitions of each one of the parts individually. So we have iris inflammation, oocyst, abnormal condition, OUS pertaining to, and tummy, it is an incision. Incision is when we cut through something, an organ, skin, a bone. That's called an incision. Let's see some of the prefixes, because remember, these are suffixes at the end, and the prefixes before. Some of the most common prefixes that we're going to encounter are epi. Remember, epi means above. Remember, we just saw epigastric, above the stomach. The opposite is also true, hypogastric, below the stomach. Remember, these prefixes, they are defined as location, quantity, numbers. So that's position. So this is position above, below, intra, inside, within. So remember that we have epigastric, hypogastric, intramuscular, inside the muscle, within the muscle, intravenous, inside the vein, within the vein. Per means around. It's not above, it's around, over. Sub is the opposite. Sub means under. Remember, it's like the subway. Subcutaneous. We're going to talk about subcutaneous. We went already cutaneous. Cutane, skin, subcutaneous, underneath the skin. Percutaneous. Percutaneous might means two things: under the skin or through the skin. So we always have like 1, 2, or 3 definitions for each of these prefixes. And we use the one that correlates better to the term that we're trying to convey. So that's basically how this works. So let's see some medical terms that has the word root, probably a combining vowel, and the prefix or the suffix, to see how we are going to interpret those medical terms. So once again, little by little, you're getting familiar because we are kind of repeating most of these terms continuously. So if we start using the same suffixes, prefixes, we just change the word root depending on the system that we are dealing with. It's going to be a lot easier for us to kind of retain this information because we are repeating almost the same thing, but with a different word root. So that will help us. Okay, so let's move to the next slide. Here it is, hypodermic and subcutaneous. If you see on the upper part of this slide, it says right here, hypodermic, subcutaneous. It's the same as down here, hypo, under, derm, skin, IC, pertaining to under the skin. That's how we have to read it. It says right here, subcutaneous. See? So sub means under, just like hypo. Cutane means skin, and OUS pertaining to. IC pertaining to. Derm pertaining to. You see, derm, cutane, dermat, or skin. So it says right here, subcutaneous, pertaining to under the skin. You cannot say pertaining to the skin under. Doesn't sound good, right? Grammatically speaking. So you put the words correctly. You cannot say under the skin pertaining to. Doesn't make no sense. So remember that I told you that when we are trying to define, to read a medical term, we begin by the suffix. Always, always. There's no exception to the rule. It's just to start reading it. Remember, if we have these terms up here, this is subcutaneous. So here we have OUS, cutane, and sub. So here we have the prefix, we have the word root, and we have the suffix. So we start from the suffix. Pertaining to, underneath the skin. Just think about it. You cannot say pertaining to the skin under. Doesn't sound good. Under the skin pertaining to, either. So pertaining to under the skin.
Professor, I have a question.
Sure.
So when do we use hypodermic and because I know like subcutaneous, but like when do we use hypodermic?
Hypo means the fat tissue. So right here, we have the fat. See? This one and this picture. Oh my God, what am I doing here? Oh, okay, right here. This is the fat tissue. Fat tissue is called hypodermis. So hypodermis means that it is underneath the skin. So the skin has three layers. The upper layer, epidermis, dermis, and hypodermis. So hypodermic means pertaining to the underneath the skin. So it will be on the fat tissue that we are going to inject this medication. So that is the subcutaneous tissue. Right here, it doesn't show it, but the subcutaneous tissue is the same as the fat tissue. It's the same as the hypodermis. See, in medicine, we have problems because we have one part of tissue or organ that can have 1, 2, 3 names. And we need to know when to use each of them. depending of the context. If I'm going to give an injection, I know that I'm going to do that. But if I'm going to do other procedures, I don't use hypodermic. I'm going to use subcutaneous. So subcutaneous hypodermic means the same. Is that understood? Just the same name for the same structure, the same layer of the skin. Remember, we have epidermis, dermis, subcutaneous, epidermis, dermis, hypodermic. So that's how it's called. So they have two names, or fat tissue, which is the same. But fat tissue will be the translation to English. But subcutaneous, underneath the skin. Remember, sub, under cutaneous skin, hypo, under derm skin.
So saying hypodermic injection is correct?
Yes, you're gonna
Okay.
give a hypodermic injection.
Okay.
Or you're gonna give a subcutaneous injection. It's the same.
All right, thank you.
No problem. Yeah, these terms are confusing because, or the fact that they use 2 or 3 different terms for the same structure. So sometimes we can use the same term to explain something. Sometimes one term can be used for one thing, another term can be used for another thing, because it do not work using the same term. That's why we have different terms. Okay. So here we have it once again, the same terms that I have up on top. I have it broken down in the bottom as we already did. So we know what hypo and sub, derm, cutane, and IC and OUS. So that's definitely what it is. Okay, so this is a term that you're now gonna get very familiar with because we know the condition. When you have fungal of the nails, we call it onychomycosis. That is the correct medical term. If I'm going to bill the insurance company for a fungal infection that I treat you with, I'm not gonna send written on the medical record or as a diagnosis. I'm not gonna put, oh, nail fungus. No, that's not how it's done. I'm gonna use medical terms. Reason why I'm charging you for my services and the procedures that I did, I treat the patient for onychomycosis. So let's break this down because it's written on the bottom. So onyx, remember that I told you that it was nail. Mike is fungus. Oocyst is an abnormal condition. We went over that. So this is an abnormal condition of the nails. Oh, wait a minute, what I did here. This is an abnormal condition of fungal in the nail. See, right here, we have to move this a little bit around. This is abnormal condition of fungus in the nail, not nail in the fungus. It doesn't work the way. So the first thing when I read the medical term, we start with the suffix. Don't worry about the other ones. The other ones, you accommodate them accordingly. But when interpreting, defining medical terms, we start all the time from the suffix. Don't forget about this. These are national exam questions. Onychomycosis. Remember, osis means an abnormal condition. Mike, we do not use myco here because the prefix right here starts with an O. Can you imagine onychomycosis? Oh no, that would be too redundant, right? So this will be the suffix right here. And suffix starts with a vowel, so we just leave it without the combining vowel because we don't need it. On the other hand, onyx ends because this is another. See, we have here two word roots. Onyx is a word root. Fungus is a word root. And in between two word roots, we have a combined vowel. But because the first word root ends in a consonant and the next word root starts with a consonant, we cannot have onyx. I don't even know how to pronounce it. So remember, the combining vowels are used to make sure that we can pronounce. We're going to connect two parts of the medical term that can be pronounced correctly. Other than that, it will be very difficult. Without the O, how can you pronounce that word? It will be really, really difficult. So right here, we have once again, this medical term has, remember, word root, combining vowel, word root, and suffix. How many parts we have? 1, 2, 3, 4, 5. We have two word roots, one combining vowel, one suffix. What is the other one? The combining form. Remember, here it is the combining vowel plus the word root. That's a combining form. That will make 1. Onyx will make 2. All by itself, 3. Mike, 4. Osis, 6. Oh, 5. I'm sorry. I'm skipping stuff. So that's how we are going to work with these medical terms. We need to know and start applying all these guidelines to make sure that we got the correct information. So if they ask you, okay, how many parts does the medical term onychomycosis has? It has 5. Remember, 5 is not just that you're gonna go there and says, oh, here is the suffix. So we're gonna do the suffix, osis. This is 1. Oh, Mike. This is 2. Oh, this is the combining vowel, is 3. Then we have onyx. This is 4. Yeah, but what about the combining form? The combining vowel and the word root. Now we have here the combining form. Remember, we don't have the combining form right here. Oops. Oh, it doesn't allow me to. But this is the combining form. So you have 5. So make sure that you do understand what we're doing, because other than that, it's going to be a little difficult not understanding that every single part in a medical term counts. Remember that if we have a combining vowel, we already have 3 parts: combining vowel, the word root, and the combining form, and so on and so forth. So we try to make sure that we don't kind of skip anything right here. Okay, so let's talk about now. We're going to build those medical terms, those word roots. We're going to put it together with the suffix. And if there is a prefix, we're going to have a prefix there. So hypodermic, we are already familiar with this word. Hypodermic. So we have hypo, we have derm, and ic. Do we have a combining vowel here? No, there is no combining vowel. Hypo is the entire word, and this is a prefix. You don't have combining vowels before the word root. So this is a prefix, hypo. This is the word root, derm, skin, and this is the the suffix, which is Pertaining to under the skin. See? So that's how I want you to work on this. Make sure that you break down these medical terms in its parts. So now you can identify each one of them. What is it? What it means? Intradermal. AL, derm, intra. So we have the suffix, we have the word root, and we have the prefix. Because intra means location. Derm is skin, inside, intra. Derm, skin, word root. And AL is the suffix, pertaining to. So we go pertaining to inside the skin. Pertaining to within the skin. Little by little, I know you getting it, because we are going to be repeating this over and over and over. And particularly, we're going to be continuing using mostly the same suffixes and prefixes. We're going to have, of course, change some of them, but some of them are going to come back again because it can be reused in different terms. Okay, so onychomycosis, we already tried this one. Osis is the suffix. Mike is a word root. O is a combining vowel. Onyx is the word root. So we have two word roots, one combining vowel. So right here, we're gonna have is an abnormal condition of fungus in the nail. How many parts this medical term has? Remember, we're gonna have two word roots, one suffix, 3, one combining vowel, 4, and one combining form, because it is the combining form, the combining vowel, and the word root, combining form. You might be asking a medical term during the exam. Which is the what the combining form in the following medical term means. So you need to give the definition. In this case will be onycho. What is onycho? Nail. That's the combining form. Any questions? Remember, if you don't understand something, you want me to go over something else or review it or repeat it, let me know. So I want to make sure that you guys getting this. This is very close at the first one, as the anterior one. Onychosis. Osis is the suffix. Onych, remember, this is the word root. So onychosis, this is an abnormal condition of the nail. Doesn't tell us that it is a fungal infection. It can be something else. The nail has some other issues. It is an abnormal condition. So if the nail has another condition that is not fungal infection, well, this is an abnormal condition of the nail. That's it. So just understanding the meaning of each one of these medical term parts is how you're going to understand. Remember, every single time that I have a different suffix, it's like having a different last name. You have a different person. So you have a different medical term. The definition is different. Yes, osis, onyx. It is an abnormal condition of the nail, but it's totally different from onychomycosis, because this is giving me details of what exactly is the condition. The condition is that you have fungus in your nail versus it's an abnormal condition of your nails. Maybe they are very thick, they are very weak, they are, I don't know, so brittle. They have some streaks in there. Probably you don't have the nail. It's not coming out, something happened. So it might be any condition. So once again, onychomycosis give me more details about the condition of the nail, not just saying it's any condition. It's like when you go to the doctor and says, or when you tell someone, I feel sick. Well, feel sick is a very general statement. But if you said, I have a headache, you're sick, but now you have a headache. Oh, that's a different issue. Because feeling sick means many things. Sick of what? What is it that you have? Maybe you're feeling sick of me. That's a different issue, you see? So feeling sick means a very broad statement. So in order for us to understand, you have to be very specific, give more details. Let's talk about the next one. Onychotomy. So we know what is onychom. We know that because we learned that it's nail. And we learn what is tomy. So tomy is here. Tomy is the suffix. O is the combining vowel. Remember, we cannot forget that. And onyx is the word root. So if I have a combining vowel and a combining in a word root, that is a combining form. What is tomy? Tomy means an incision, cutting through something. So this is a incision to what? To the nail. We are making an incision to that nail. Probably that nail is ingrown, an ingrown nail. So we are going to cut through to remove the part that it is within the skin. So remember, tomy means an incision, to cut through something. Here we are cutting through the nail. So that's how we are going to understand these medical terms. Remember, what we have with medical term, we have to break it down, divide it in its parts, and then start interpreting, defining each one of these parts. When we have all the parts, now we can give a correct definition. Let's look at this one. We saw this already. Percutaneous. OUS, this is the suffix. Cutane, this is a word root. Hair is a prefix. Percutaneous, it means through, pertaining, says right here, pertaining through the skin. Pertaining through the skin. So that means that we're doing something through the skin. We're going through the skin. So surgical procedures goes through the skin or through the muscle or through the bone, depends on what is it that we're talking about. That's called percutaneous. Subcutaneous, once again, remember subcutaneous is a little different. Why? Because we need to mention what is it, what is the location that you're going? You're going under or you're going over or you're going around. Subcutaneous, OUS, suffix, cutane, word root, Sub is the prefix. Sub means under. So pertaining, under the skin. Is under the skin. Under the skin, but we cannot ignore the suffix. It says pertaining under the skin. Remember that these are medical terms derived from Latin and Greek. And at that time, when they used this language, they were using the language the way that they interpreted. So the grammar that they use is a little different than the grammar that we use. It's like if you're going to interpret something in Spanish. In Spanish, you have to go, it's the opposite of what you said in English. So once again, some of the words we need to interpret like backwards. Other than that, if you say it exactly, textually, literally, the way that you pronounce them is not going to be understood. Or people is going to be looking at you like, okay, what's wrong with this person? What did they pronounce this? It's like when you translate things in Spanish to English, or from your language to English, that has a different grammar, synthesis. It's going to be difficult to understand. Yes, sometimes you understand it. Some of the things kind of said, oh, I understand because this person is trying to say it and doesn't know the language. But there are some terms that we don't know. So we can put one together, but the other ones are disconnected because we don't know the meaning. So if we don't put it together, then it's going to be difficult to understand that. Okay, so let's go one more. Oh no, wait a minute, we're done. We're gonna finish right here. Remember, we finish, that's slide number 7. So tomorrow we're gonna continue with slide number 8 until we finish. So like 16 slides, 17. All right. So any questions before we say goodbye?
Bye, teacher.
I know you are very angry because I'm letting you go early, right?
Yeah, so angry.
Very much, yeah. Listen, don't blame on me. Then you're gonna say, oh my goodness, the professor let us go early, we're gonna complain. So no worries, because I already spoke to the director. This is not something new, okay? Because it's a lot of information, particularly these chapters are very difficult to kind of absorb. So if I start injecting you with every single term, at the end of the day, you're not going to learn anything. But still, we're going to have plenty of time to go through all the chapters that we need to cover for this class, all right?
All right, good night.
Okay, thank you so
Good night.
much for
Yeah,
participating
bye.
in the class. Every single day, we're getting a little more like active, and we're gonna finish this in good stance. So you guys gonna get this. All right, just take a little time, be patient. Thank you again. You guys have a great night.
Good night.
All right, take care. See you tomorrow.